And indeed, I count it as a big privilege being given opportunity to share about girl-child abuse and the role of a nurse in this avenue. And I'm quite grateful to all the organizers and for giving me this opportunity. Actually, I just thought of this topic because in my own area, I found sort of discrimination happening on a girl child, where I was growing as a child and in my community around, even in my own neighborhood. And therefore, I thought I should do something about it. And I took up a study actually for my thesis, for my MSc thesis way back in 1991. And I took 700 families for the study. And almost the topic of the then was gender bias, girl child negligence and gender bias. And I studied different areas like in terms of education, in terms of immunization, in terms of healthcare provision, in terms of child labor, in terms of various other components. And in that, almost every area except for immunization, healthcare provision for children, every area there was a discrimination identified. Out of the 700 families, statistically significant difference was found where the girl child was discriminated. In every domain, in the terms of education, in terms of healthcare provision, where they preferred good education, college education for the boy child, whereas for girl children, they only wanted them to study, if at all they have to study, they only should study till 5th standard, primary school alone. And in terms of healthcare, they preferred hospitalization and allopathic care for boys compared to girls, where they would give some homeo treatment or if only needed, or sometimes they don't go in for that. This happened sometime in 1991, but still we as a community, we are doing lots to change the scenario, and it's far better. It's far, far better, we must say, because we have intervened and we are helping the kids out. But still, I cannot say in India, the status is not the same. In India, if we see, or even I should say in underdeveloped countries, the girl's child status is not as equal as boys. Probably in Western countries and developed countries, the scenario may not be that bad, but definitely in underdeveloped and developing countries like India, the girl child suffers. I myself, I witnessed, and my study way back in 1991, that also proved that this will be the topic to share. So child abuse, what is child abuse? We all know that when the parent or the caregiver, whether through an act of failing to act, causing injury, death or emotional harm, or risk of causing a harm to the child. And it can be in terms of physical abuse, it can be sexual abuse, it can be exploitation, it can be emotional abuse. And adults can experience range of psychological, emotional, and various other problems. And people who abuse their children, when we look into their history, I'm sure all of us know, they way back in their childhood period, they would have had some kind of abuse, and therefore they are projecting it, because we know growth and development is so interlinked, and it would have hurt them so much, and therefore they project it when they get married, and when they produce children, they try to show it up on their children. So that is how the scenario is in our country. And not saying that nothing is being done for that. Definitely the government is taking a lot of steps towards it, and all the healthcare agencies, whether it's private or government or the NGOs, the non-governmental agencies, all of us are working towards removing this dismal status, but still we cannot say we have really struck a balance. So child abuse is any action by another person, adult or a child, causing significant harm to the child. It can be physical, sexual, emotional, but can just as often be lack of love. Sometimes it may not be beating the child up or causing a sexual, but even if they just withdraw, giving care to the child, giving attention to the child, giving love and care to the child, even that is a kind of emotional abuse. We all know that. An abused child will often experience more than one type of abuse. So if we probe into the history of these children, actually we have an adolescent medicine clinic here, and we have kids coming up, and also in the child. Nowadays, the sexual abuse is also becoming very, very common. very sadly, it's becoming very, very common. Like yeah, I'm working in pediatric department, pediatric nursing department, and when I see these children, even 1 month old child sexually abused either by the relative or by the neighbor. And it was just shocking. Even some months ago, 1 month old child where the mustard seeds and cumin seeds were found in. So like, and sometimes even the blades are put inside the vagina of a female child who's 6 months old. And one other child came where the child basically is a child with leukemia, which has a bleeding tendency, and where this particular boy, neighborhood boy, had caused a kind of abuse, and this child literally was bleeding. And finally, we lost the life of the child. So, such is the kind of dismal status which exists. And all measures are being taken by various bodies, but yet I think justice to be made pronounced in a very sharp way, so that this will not happen again and again. And actually, government is taking a lot of steps, and they asked our institution to come out with a policy protocol so that it can be implemented all over the country. And we drafted actually a protocol kind of a thing, and we have shared it with the government, central government, and soon enough they will take it up and they will approve of it, so that that can be copied on to every other organization in the country. So the total number of abuse, the rate of children, if we think, it is 25.2 per thousand children. And with the physical abuse counting for 5.7% per thousand, and sexual abuse counting for 2.5% per thousand, and emotional abuse 3.4 per thousand, and neglect accounting for these categories overlap with sexual physical abuse often occurring together. Physical abuse or neglect seldom occur without emotional abuse. And so violent behavior. And here, when our children, when they come, schoolers, and I remember one particular child was literally sobbing outside the OPD, and not wanting to get inside. And finally, when we intervened and when we spoke to her, she kept on crying, and she said, you know, my father keeps on calling me Gundupunu. That means I'm an obese child. Every day, in and out, when I get back to school, in the school, they're teasing me that I'm an obese kid. And at home also, my parents supposed to be the no, next to God, and my father keeps on calling me an obese idiot, obese idiot. So this hurt the child so much, and we had to intervene and we had to counsel the father. It took a little bit of time, but yet a lot of improvement is shown now with the family kind of a thing with follow up. So emotional abuse refers to the psychological and social aspects of child abuse, and it is the most common form of abuse which can happen. Now gone. Sometimes gone are the days where we had kind of extended family support. Now, most of the families are nuclear families, only the husband and wife and the child or two children. And so it is very difficult to get social support even. We don't even know who's the neighborhood. We don't even know who's residing nearby. And therefore, children suffer loneliness, and all those kinds of struggles are there. And so they associate their own negative feelings with the child's typical behavior. And actually, I'm reminded of a mother who was literally beating up the child in the ward. That was the first day of admission, and she kept on beating up the child on the head. And we just quickly ran to the site and said, well, why is she doing that? And when we looked into the history, mother herself is psychologically disturbed, and she was saying the sibling rivalry are not able to cope with, and she herself was in, and the husband left her and went. So she's not having her own income, and husband left just because the child became sick. The husband left her and went, and no social support, and now she's not able to manage the sibling rivalry situation. Finally, we had to give a psych consult, and now much of restoration has happened, and now we can see the family doing well. Of course, the father did not come back. But yet, of course, the mother is now able to manage the two children, and the follow-up shows a good kind of workup for us, and therefore it satisfies us. But this is the kind of scenario we time and again see, and particularly with girl children, this is very, very obvious. So poor parenting methods, and sometimes the parents become too restrictive, and especially when they fall sick, they think they cannot have a kind of normal life, and so they become too protective, too restrictive, too disciplinary, and that also hurts the children very much. Working as a pediatric nurse, it pains our heart, and of course, our counseling, our nurses really, we salute them because they do so much of input. They give a lot of input into their counseling mode and all that, and a lot of satisfactory results are found, and we really salute our nurses here. And so parental mental health problems are also there, domestic violence, and as I shared with you, the MSc thesis which I did, where discrimination was found in almost all domains like education, healthcare, even the number of infanticides and feticides were high. This thesis was done from 91 to 93, 700 families. Infanticides and feticides were mostly females. So, but now, of course, we have a system in place, the legality and all that. So, sex identification, it's not allowed. And therefore, the scenario is changing. But it also, we have this dowry system. In India, I'm sure you would have heard dowry system, where the girl has to give a lot of money to the boy, whether educated or uneducated, she has to give so much money to the boy. And in case she's not able to continue to give that, then the girl is tortured, or the girl is sort of ill-treated by the family members and things like that, and sometimes even by the spouse. And here again, I'm not saying it is so widespread, but definitely I cannot ignore the fact that it is prevalent. So drug and alcohol misuse, when now is a scenario where because of the overworkload or no job opportunity or economic strain or whatever, more of drug addictions and alcoholic misuse happens, and that also causes a lot of disputes at home. And so some of these children turn out to be delinquents, and sadly we had to join these children for delinquent schools, which is very painful. And of course, the delinquent schools are doing really good job of training them, equipping them to become, if they can study well, they can go for higher studies, or if they can do some skill-based work, they can. So juvenile, we right now in our place, 2 places, we have juvenile delinquent home. So many children are there, more than 3,000 children. They are really, really doing a good job about it. So being abused or having been in care as a child causes emotional abuse, and so these children, we can easily make out they feel unhappy, they feel frightened at the stranger, they feel distressed, behave aggressively and antisocially. And one of the children, I can remember, the child was literally sobbing, crying, and I was asking what happened, and parents, they did not want to take the child back home. As long as the child is in the hospital, they're happy. Once they go out, and so as a team, we went to, it's a nearby place to Vellore, and so we went and we saw literally they had thrown the mother and the child out, and on the veranda, they were made to cook. Such a kind of discrimination, socially stigmatized. And so now the child doesn't want to, in the hospital, the child is given free food and things like that. So when the child gets to know the thing that getting discharged, starts sobbing. So this is definitely there. I'm not saying in every family, but definitely it is there. So these children, one child actually was rehabilitated because the father was abusing, and also the teacher was abusing. He ran away to the railway station. Almost at home, he will say that, no, I'm going to school, I'm going to school. But when later on, after 6 months, when we found the child in the railway station, child was giving a story of how he was beaten up by, child did not do well in the studies. That is definitely there, but we cannot be so harsh on the kids. For some reason, child is not doing well in the studies, and so finally we had to counsel the parents, and now the child has become a professor. This happened long back when I was a student, third year BSc nursing student, and now I see the child an engineering professor. And so I really salute the team, the medical team and the nursing team, which works towards these children. And we see them either being hooked up with the NGOs or the community-based organizations. If we are not able to help them by ourselves for their education and things like that, we channelize them, we hook them up with some community-based or NGOs and things like that. And like this, we can quote so many examples where children are rehabilitated, counseled, and the parents are also counseled, and we see the good return of the hard work that is going on by the team here. So these children, they find it difficult to make friends and show signs of physical neglect and malnourishment, and experience incontinence and various kind of pain issues. They will have mysterious pain issue. One boy actually was saying he was pouring ink, red ink in the urine, and he was, and the mother, illiterate mother, she was thinking it's hematuria. Every time she will bring the child with hematuria, and finally it was a kind of hysteric attack for the baby, for the schooler. Some children show up with seizures and things like that, hysteric seizures and things like that. So it is very, very sad, children being abused, and particularly the girl child. When we see the proportion, it is definitely much higher among the girl children. So they become withdrawn, they become unhappy, some of them become violent, aggressive, some of them do bedwetting and also self-harming. Some of them turn out to be autistic kids. They do have anorexia nervosa and other eating problems, bulimia. Mood swings are there, detachment and pain for no medical reasons, and sexual behavioral problems as well. They're not able to get along with any sex for that matter, especially with the opposite sex. Language difficulties, learning disabilities, and various other kinds of struggles they do come up with. And why do the parents? I also remember one other case where the father actually abused the kid, and this child, actually they had to do a colostomy with the vaginal tear, with the anal fissure, and child also was almost heading into a blindness and so many problems. And finally the wife was not willing to reveal. Well, probably she was scared, and finally we had to separate the husband. And now we hear it became a big police case. Actually, we say that this case should be, every case for that matter, now they made it very mandatory. Abuse should be informed to the police within an hour by the medical team, by the nurse who's involved, and by the medical superintendent as well. Otherwise, imprisonment for the medical personnel for 2 years, and for the nurse that is involved 1 year. So the team intervened, and finally we saw that this child had multiple kind of exposures and multiple struggles, where the child was rehabilitated, and now we have handed over to an agency. Child is sort of doing okay, and but we sadly heard that the father committed suicide, and like that. Actually, he was imprisoned, and then later on, such issues. So adults, why do they behave like that? Did they have an abuse at childhood? Yes. So if they've had some kind of traumatic experiences in childhood, that makes them become abusers later on. So children are angels, and if they are targeted, and if the family is targeted and revived at the correct stage, then probably we can prevent this girl child abuse, or generally child abuse for that matter. So neglect also is a kind of concern. One child came actually from one of the other neighboring states, where the father was beating. Child did not have a mother, and father was literally beating up. And this father actually was present so many times in our neighboring state. And somehow how this was going on and on. And finally, the relative had to bring the child here up. And finally, I'll catch up with you later. Finally, it came up like where this child was diagnosed with the failure to thrive and tuberculosis and all that. And when we came here, when we received the child here only, we understood that it is a child of abuse. And anyway, the father is still in prison, but we are rehabilitating the child, and child is doing pretty much well. That's a kind of scenario. So nurses play a big role. Pediatric nurses, they really play a big role. So we make sure that every child who comes in with any kind of ailment, whether it is with bronchopneumonia, any kind of, we do this assessment for abuse. Every child, we always make a kind of suspicion when, especially the history is so alarming. We make sure that the screening is done, and especially children who come chronically to us, we make a screening about that. And so One is screening, and we actually have formulated a team. It has been there for quite some time, actually, should I say, for the past 5 years. But now we are making nurses' role more evidenced and nurses' role more strengthened. And we have created the admin has created a post also where child sexual protection can happen and the nurse can be empowered and things like that. So it is more in a better way and in a more structured way happening. So nurses can counsel the child and the family. So when we actually the team which has the medical person, the pediatric surgeon, the forensic doctor, and the nurses there. Now we have introduced nursing team, particularly 2 nurses are there in the team now, and also others like the psychologist and all that are there. So in the team, so the nurse is the one who's alerted, and she quickly informs everybody, and the team is alerted, and all the formalities are followed up, and then the police is informed. They come in for their interrogation and things like that, and immediately the procedures are followed up. So family violence, sometimes, as I told you, because of the dowry system, we do have struggles. Girls getting married, and the relatives, the in-laws, they demand for dowry, and various kind of struggles in our setup. So a child witnessing family violence, sometimes it may not be on the child, but sometimes it is between the spouse, the husband and the wife fighting, and the child watching that, and child, it ruins the child's personality. May not be child is beaten up, but the child watches the father and the mother fight, or the fight that happens in the family, that causes learning disabilities, behavioral and emotional difficulties. The child is not able to coin up with anybody, not able to move with anybody in the school, isolates himself, herself, and long-term developmental problems and aggressive language and behavioral problems, and restlessness, anxiety, depression, all these are evident in these children, where the children are not abused, but the parents have conflicts, and that definitely causes a kind of emotional strain on the children. Sexual abuse, where we have a good adolescent team, and where the medical and the nursing together, we go as a team to schools, and we make awareness about good touch, bad touch, and about the cautions that they have to be on. They should not answer to the strangers, and sometimes even these strangers come to the school spots, and they tell your relative, your mother, your mom is admitted, or just like that, they take them and go. So we alert them not to respond to or dad is admitted, or they're sick or something like that. And also we are teaching them the self-protection techniques. Sometimes it can be where the boys can be more violent, especially the street boys, not the school boys, but the street boys can be more violent. They can just use knives and things like that, weapons. So we teach these children to be more careful for self-protection. We teach our girls and how to protect themselves from school kidnaps. Various other teachings are going on, and we actually want to make it even more regular. We go, we have around 535 schools in the district, and because it's a kind of integrated system, we are not able to do it at the moment very frequently, but we are going to make it very frequently, so that this awareness can be brought forth very well. So the CSA nurse, the child sexual abuse nurse, and the team, they are working towards it. So all the proceedings like investigations, x-rays, and the swabs, all those are being the physical examination, that all will be taken care by the team. And so the nurse has a role in playing in terms of counseling the child, counseling the parents, and making sure that the medical treatment goes on well with the nursing care in the ward. And also these children are followed up in the community. Except for police interrogation, we said we will not involve our nurses for the police interrogation, maybe a social worker, male worker preferably, because of the various stigma that are attached. If our nurses are in the team, then it will be a kind of stigma for, because we are not so developed as it. And therefore, we said for police interrogation alone, if the social worker can intervene, a male social worker can intervene. Otherwise, the nurse, she's there in every step of counseling, in the treatment modalities, in the nursing management, in the care, and we involve the parents for decision making, and we have a good psychiatric team as well, besides the medical team that is working on, and the forensic team along with the pediatric team. So recognizing the potentiality for child abuse is very, very important. And so, as I told already, we do the screening in the schools and in here also patients who come in, and we make sure that we support them throughout. And if there are some kind of help which can be offered, like through the extended family, if they're reliable, and if it can be affordable, then we try to seek the help of the extended family, friends, and clergies, and the leaders, village leaders, and so on. And we also hook them up with the community-based organizations and also with the NGOs and things like that. And we also have some kind of fund provision where these children can be helped out for their education to some extent. And we also pay them off for their medical bills, looking at their background. So nurses, they can involve themselves in preventive role, in curative role, in rehabilitative role, in all therapeutic domains for that matter, providing emotional support and offering, and they actually can call us anytime. We have a nurse where even middle of the night, we have given the number, the parents can call them at even middle of the night in case they feel any threat and things like that, because it's a team and always the team can butt in there and they can support. And actually, we are yet to develop a kind of networking, parental networking. This is what we are trying to do in future. That's a kind of thought which is going on our minds. And also to bring in an online course, short-term course, at least for 3 months, so that we can educate our nurses in the mission hospitals, in the government setup, in private government hospitals as well throughout India, so that more of awareness can happen about girl-child abuse as well child abuse, because child abuse is a major concern, and we really want to do that, and we need your prayers. And we are actually very thankful to all the organizations which support us throughout the world. And many of us have learned quite a lot from the teams abroad. And so we are very, very thankful to the team around. And especially I'm thankful to the team for giving me this opportunity to share our burden. And your talks also have been very fruitful. And personally, I've learned a lot from your talk. Thank you very much. And I can take on questions if there are any.